right, we're going to get started here in just a few minutes. We're going to give everybody a few more minutes to join us, and then we'll get started. All right, let's go ahead and get started. First, I want to thank everybody for joining us today. Welcome to what is a roundtable discussion with legacy brokers and OMNI Human Resource Management. We'll be looking at the Families First Coronavirus Response Act, looking at staff reductions, and really looking at things from an HR perspective and how the COVID-19 crisis impacts a lot of things that are happening in small businesses across the country. So thanks everyone for joining. The process for today, we're using Zoom, and Zoom has a question and answer feature in the app. So if you have questions specific to the topics that we're discussing, I would encourage you to use that Q&A feature to ask those questions. We've got team members that are monitoring those questions. We'll circle back at the end and open things up to respond. If you've got any kind of technical issues, there's also a chat feature in the Zoom application. Be sure to use that to communicate with our team about any technical problems that you're experiencing. And then last but not least, if you have a reason to interject, feel free to raise your hand. Our team will take note of that and call on you as time allows. After today, we certainly encourage you to reach out to Mike Tracy at OMNI Human Resources. He's going to give really the meat and potatoes of the presentation here today. Mike is the managing principal of OMNI Human Resource Management. His contact information is there on the screen. My contact information is available as well. My name is Jason Powers. I head up the sales department and the employee benefits side at Legacy Brokers. My direct contact information is there if you have any questions for me. Last but not least, the websites are good resources as well. We've built a specific page for insurance company responses to various questions that we've asked over the last couple of weeks, and we're updating that on a daily basis. So with that, I'd like to introduce everyone to Mike Tracy from OMNI Human Resource Management. Take it away, Mike.
I will. Thanks, Jason. Hey, we're real excited to be able to offer this and participate with Jason and Rick. There's an awful lot going on in the business and people space. And a lot of what we're dealing with has a lot of benefit implications. And I'm really glad to bring in the experts to talk about some of the things that cross over into our sandbox, but we're not necessarily going to consider ourselves expert. And that's when it comes to the benefit side of the house. I just thought I'd take an opportunity to tee up a couple of big things that are happening all over the place, because there's this collision of events that's happening, but I wanted to divide and conquer those collision of events into a couple of different things. The first thing that we've been working aggressively with our client group and our organizations is, at the end of the day, there's a need to reduce costs. And so the considerations of how that's being done, especially when it comes to humans, is a lot of different ways. And one of the things that we want to be careful in helping businesses and owners and nonprofits understand are the different ways to reduce those costs and some of the considerations to go along with it. So the words here, I'm going to redefine sort of in the vernacular that we like to define them. And that is, one of the ways people are going to reduce cost is through a leave and or what we're going to use the word furlough. And I want to define furlough because it's like a leave in the way we'd like to define it. It means people that are being displaced from the payroll registers, but actively engaged on the payroll, participating in the benefits, no change or degradation in their participation or activeness in the retirement 401k plans. And a furlough is a short-term way huge corporations and small can reduce staff on a temporary basis with an expectation, not a promise, but an expectation they're going to come back in the near term. I'll come back to that. The second is reduced pay and hours. Common practice, we've got several people that have taken people to what otherwise might have been full-time hours, but there just isn't enough activity, reducing them down to part-time status. They're active on the payroll, but they're falling into a different status. The third is layoff and termination. And this is truly the separation of the employment relationship, the end of the employment relationship, and the end of the benefit obligations and eligibility. The reason these three are so important is because you want to be sure you're going to hang on and retain and get back those that are important to you as soon as possible. So I'm going to come back to leave of absence and furlough because all three of these have implications for state unemployment, eligibility, and benefit implications. Leave of absence and furlough is a practice that may in fact result in people being able to receive state unemployment, and general media suggests state unemployments are opening their doors to people on furlough and minimizing this need for employees that have to demonstrate they're looking for work. Generally under state employments, part of the criteria is proof that you've been looking for work. I know in the state of Kansas, I think yesterday Governor Kelly indicated that they're eliminating that requirement right now for people receiving state unemployment benefits, at least in Kansas, because it's just not reasonable to deal with the chaos that's happening right now. And a greater order is to protect the interest of folk. So leave of absence of furlough is a staff reduction, minimizing payroll expense. It does have SUTA implications, but how long somebody remains on a furlough is the question. Just like how long you remain on a leave of absence before the benefit carriers make decisions that you're no longer eligible for their plans. And this is the slipperier slope that I want to be sure owners are paying close attention to, that they're reading their contracts and have some idea of the length of time they can keep active employees on a furlough status without putting their benefit eligibility on the line. And I might have Rick and Jason talk a little bit more about that in just a minute. The same applies for reduced pay and hours. Going from full-time to part-time status is a great short-term way to reduce costs. How long are you going to be able to keep those folks on a less than full-time status without serious benefit implications? And so those are the areas of making sure that owners and managers are paying attention, because the worst thing that will happen is a false expectation. You've kept somebody on a reduced staff status or on a furlough longer, and all of a sudden wake up one day and everybody realizes, oh, wait a minute, you've fallen off the benefit rosters. The layoff termination is a more permanent and technically ending the employment relationship. The challenges here, especially when it comes to benefit implications, are, so how do I return these people? Do I have to rehire? Do I have to start all over again? Can they get back in the benefit plans? And what's the risk of losing somebody when they have to go through too many hurdles when you want to get them back after a formal termination And I'm putting the word layoff here just for clarity of definition. And so there are serious benefit implications that come along with bringing those people back. So what's happening is all three of these things are happening. They're all happening at the same time in the same company to different people. And I want to be real helpful and clear about having people think through the implications of where each of these different actions may result in things that you don't want to have to go back and not be able to fix. So that being said, I'm going to ask Jason to dip a little deeper into what are the benefit implications for each of these three employment actions, and a little bit about what some of the carriers might be doing today to cut a little slack. Jason, why don't you pick it up from there?
All right. So those were all great questions that we asked carriers a couple of weeks ago when the initial announcement came out to flatten the curve of the coronavirus. And so what we noticed was we had various answers that weren't consistent throughout. There was no uniform response from the insurance market. So that really caused us to go back and take a look at the different policies, the plan document language, and where we came to was really making sure that every employer checked their summary plan description for a leave of absence provision. In most cases, those summary plan descriptions include language for coverage to continue if an employee is on an approved leave of absence. In some cases, those are 90 days or 12 weeks. Some are shorter. What the challenge to employers for the second challenge to that is how the premiums are paid. It's one thing to continue coverage, but who in fact ends up paying for that insurance premium? When employees are on an approved leave of absence and the coverage is continued, if the employer chooses to continue to pay those premiums on behalf of those employees on that leave of absence, are they set up to then maybe recover payroll contributions later when those employees return to work, or is the employer prepared to essentially take on the full expense and not recover those funds back from employees that return? The other question that comes into play, Mike, you mentioned layoffs and furloughs and reduction of hours. If there is no provision in the summary plan description for a leave of absence and continued coverage, or if the employer chooses not to fund the premiums for those employees on a leave of absence, then what you really have to look at is how is coverage going to be continued? Some employers with more than 20 employees are subject to COBRA. Others that are smaller would be subject to the state continuation of coverage provisions, and it varies from state to state. Most states mimic COBRA when it comes to state continuation. But another challenge there is that, especially in our market, we're seeing more and more groups move to small group, self-funded or level-funded plans. And those plans typically have an ERISA preemption from any state laws. So state continuation of coverage doesn't always apply. And it's important to understand the contract so that you're advising employees who are subject to a layoff or a reduction of hours, which then triggers a loss of eligibility to get them in the right position for any kind of continued health insurance coverage. If there is no COBRA or no state continuation in the available for participants, that what we're also seeing is that triggers a special enrollment period in the individual marketplace. So they could go out and apply for coverage through the state or federal marketplace. Another piece of that, Mike, you mentioned, when we when we come out of this and we get to the other side, employees being rehired. Most insurance plans, whether it be fully insured or self-funded, most have a provision in the policy or in the plan document that speaks to rehire and what's classified as a rehire, what kind of time frame is required for the rehire provision to kick in, and and they all vary. So what we may see is that a carrier says if an employee is terminated and then rehired within this 31 days, they may be able to jump back into the health plan with no waiting period first of the month upon their new rehire date. Others, it might be 60 days, could be 6 months, could be if they're rehired within that 12-month period. What they're addressing in that provision is whether or not they're treated as a new hire with regard to eligibility requirements and waiting periods. So with that, Mike, I don't have a good transition here, but it'd be great for you to kind of jump in and talk about what the Families First coronavirus, that really was what kicked all of this off. And FMLA is something I think that a lot of people, a lot of business owners are certainly concerned about. So let's take it from here.
Thanks, Jason. Yeah, lots of different things to look at in the benefit side of the house, with problem number one, and that is staff that you can't keep. Because staff you can't keep, this doesn't apply. So now that we're into the Family First Coronavirus Act, here's the next little basket of good times that we're all faced with right now. And that is, how do we implement and how do we take care of people who are personally affected by COVID in basically two general categories. I won't recite the act. I'm going to assume most of you have already gotten the formal poster from the Department of Labor that should have been up now and available for all your employees to see. There's a lot more detail in there, but I thought I'd just talk about this a little bit at the 20-foot level, let's just say, and make sure that you all have a general idea of the implications. One, starting today, there are two scenarios for which people are entitled to benefit under the Family First Coronavirus Act. One, enhanced FML, family medical leave, for people who need to take care of a child because school has been closed due to the virus and or somebody else. If you look at the poster, you'll see 6 criteria. The enhanced family medical is here to address number 4, 5, and 6. And that really has to do more with taking care of somebody else who's been influenced by the virus. The first 10 days of which are going to be considered technically unpaid according to the Act. And days 11 through a maximum number of dollar amounts are paid at 2/3 the person's wage. The second fork in the road, the second part of this is COVID-related absence because one person themselves needs to be quarantined because of local, state, or federal order, or one is having symptoms, or one is under some kind of medical care, where we have been experiencing the 14-day quarantine period. Individuals who are personally influenced and affected by not being able to work because they themselves are in a situation are eligible for 10 days of paid sick leave, 80 hours at 100% of their pay, up to certain maximums. And both of these can kind of run concurrently. Even people who are eligible for family and medical leave do have eligibility for a 2/3 version of the sick pay. At the end of the day, all of these wages are subsidized by an employer's credit against their employer FICA obligation. And the tricky part here is to just heighten everybody's awareness of what could be a tracking nightmare if you're not getting in front of it today. Because every hour that somebody's paid under the 2/3 arrangement can be offset and subsidized under FICA. Every hour that somebody is paid under the sick leave provision of this act is subject to subsidizing and a reduction in your employer FICA. Making sure that you have systems in place today that start to track every hour somebody is eligible for payment under these two conditions is going to be most helpful and important for your accurate record keeping when it comes to FICA. Every major payroll company in the United States has been pulling out their hair, working overtime to make sure their systems can do this. We happen to work with a large software provider, Kronos, who at 1 o'clock today finally gave us the codes that we will implement in the timekeeping and payroll systems so that the hours that are booked in the timekeeping will be run through the system, paid at the right rate, and reduce employer FICA the way they're supposed to. So I highly encourage you to get your tracking mechanisms in place today so that you have a way to be sure you're accurately reconciling your subsidized wages. There is no shortage of questions about how employees are eligible and taking this leave. Can I take the enhanced family medical on an intermittent basis? Well, if I used my sick pay because I was sick and now I have to stay home again, can I use my sick pay again? The DOL has actually done a nice job putting together a Q&A. It probably grows about every other day. And these are the things you run to your friendly HR department for if there's any reason that we might be able to offer some advice and counsel. But the implementation of this, as I described, we have legislation to implementation in 15 days, which is frankly pretty remarkable. But I think most organizations, most of our payroll partners have got this together. So the things for you to pay attention to are, one, making sure that you have a good system in place for employees to be able to appropriately ask for this leave of absence. To confidentially be asking for this leave of absence, and to make sure that you have systems in place to be able to track these leaves of absence in a manner that allows you to take advantage of the subsidies. Because at the end of the day, this is not an economic hardship from a dollar standpoint when all these wages are going to be returned to you through the reduction in your FICA costs. The challenge for all employers is going to be able to manage their workforce and ensure they have an available workforce to get the work done. There are exceptions to this act. People are trying to figure out if they qualify for those exceptions. The DOL has not yet given the exact process other than to say that put a statement together and understand why you might be exempt from this act. But for all intents and purposes, I think that bar may be a little harder to overcome for a lot of businesses to start with. During this period of time, employee benefits and carriers have made a lot of adjustments to try and be more accommodating to the medical needs of employees, both employed and non-employed. And so to that end, I wanted to ask Jason and Rick if they wouldn't mind drilling down a little bit more so that you all have an idea of what extra things the carriers are doing to help people during this COVID period of time. Jason, I'll let you pick it up from there.
All right, thanks, Mike. In fact, the FFCRA, better known as HR 6201, did require group health plans, health insurance issuers offering group or individual coverage, including all of the grandfathered plans. It requires that they cover the COVID-19 testing and certain testing related items and services without cost share to the employees, or the members. So no deductible, no co-payment, no co-insurance, and also no prior authorization and no medical management requirements. So in another slide, we'll talk a little bit more about, what that really means for some self-funded clients, but essentially all plans have to cover the testing and testing related items without cost share. We've also seen, and this is, again, this one is not uniform across the board, but we have seen a lot of communication come out from insurance companies about adding telemedicine benefits to an existing plan that may not already have it. I'd say, before coronavirus, telemedicine was something that you had to add. That was a specific company that contracted with physicians who, worked at home, or worked, maybe they have a clinic and they do this on the side. And what that has transitioned into is insurance companies are now starting to come out and approve telehealth in a different way. So if your primary physician offers up the ability to perform virtual visits because of the coronavirus, we're seeing insurance companies figure out how to handle those claims through their plans. So not every one of them has been consistent, but what we have seen for the most part is anything related to telemedicine and COVID-19 services have come out with those benefits at no copay or no cost share. We also found there are some plans that don't have any telemedicine benefits, and they're not making a change to add those services. But there is a company that came out with an emergency plan for 90 days for employers to tack on to their health plan, their existing health plan, at a certain cost. Another benefit that's come out is early prescription refills. Typically, the health plan has a restriction for certain medications to be refilled early at the pharmacy. Those restrictions seem to have been lifted, but again, not uniform across the board. Most carriers are following suit, but something certainly to look at and communicate with employees on. Another kind of shifting into some other issues with regard to health plans is grace periods on billing. Typically, most plans have a 30-day grace period built into the billing and invoicing process. Where you get, today is April 1st. April premiums are due today, but you've got a grace period of 30 days to get payment in. We just today we had two carriers on the dental side, not on the medical side, but two carriers on the dental side that announced that they were extending grace periods by an additional 30 days for March and April premiums. That's a significant shift from where we were last week, and that was that for the most part, the grace period exists at 30 days. If you're termed for non-pay, there's a reinstatement process, and some companies have announced that they're allowing an additional 30 days for the reinstatement process to take place, but not extending the grace period itself. And then as we talk about self-funded plans, and we talk about grace periods, it's important for employers who are self-funded in any way, whether it's level funded or in an ASO contract, they continue funding the plan. And that's because in a self-funded environment, the funding that comes in from the employer is funding the claims. And any delays in funding that the plan will result in delays in claims being paid. Another topic that came up over the last couple of weeks is whether or not employers, because of what's going on, if employers would be able to make off-cycle plan changes to help reduce cost. So they may have, instead of waiting till their next renewal is there a way to maybe offer a lower cost, higher deductible kind of plan off cycle? And some companies have come out and expressed willingness to allow employers to do that. Our concern there is that any material modification to a plan, ERISA requires a summary of that material modification notice to be delivered to members 60 days prior to the change. We have not seen any guidance from the DOL on whether or not they'll relax that requirement. But something that came up today is with the FFCRA, we've got now retroactive plan changes allowing COVID testing at no cost sharing and at some other services that are being offered to the plans, retroactive to March 1st in most cases. If that's the case, most employers at this point need to review that modification of their plan and put together a summary of the material modification notice to the members of the plan to notify them of those changes. So those are things we're working through. As we speak. Another topic was renewals and open enrollment. So there are companies that, albeit the most popular renewal date is January 1st, but there are a lot of companies that have renewals in April, May, and June, and which seems to be right in the middle of this crisis. And timing is critical. So if there are renewals coming up in the spring and summer, we encourage employers to reach out to their agent and not really wait until that last minute to make decisions about how you're going to handle open enrollment, what kind of changes you want to make to the policy. Some insurance companies have come out and extended open enrollment periods during this time. Typically, open enrollment is going to be the month before the effective date. And we've seen companies come out and extend that beyond for an additional 30 days beyond that effective date. Not all, again, it's not consistent. It varies from insurance company to insurance company. One particular company, United Healthcare, actually came out and announced special enrollment opportunities off cycle for individuals who maybe chose not to enroll in the plan during the last renewal period. They've actually announced a special enrollment opportunity to get in the plan effective April 1st. So United Healthcare, they're the only one that really has done that so far, but I imagine when other carriers see that, maybe they'll follow suit. Not all plans are going to be treated the same. The self-funded plans, I think, for any groups that have a self-funded or a level-funded plan, some of the things to look for, just to reiterate that the plan has to continue to be funded in order for claims to be paid. And so it's important that employers that are in a self-funded plan recognize that. And then really to review their excess loss policy for any minimum attachment points. And what that really comes down to is when you reduce your workforce and you reduce the amount of people that are covered under your self-funded plan, it sometimes triggers a minimum attachment, or you still have the same level of risk in the claims pool. And so, but you got fewer people contributing to that claims pool. So it may amplify the risk per capita when you do that. The other thing to look for is in an excess loss policy, if you've got actively at work provisions for any large claimants, we've seen, again, not consistent communication across the board and industry-wide. Some reinsurance companies are providing leniency with regard to actively at work provisions, but not all of them are. Essentially, if you have someone who's not meeting the 30-hour requirement, how are they continuing coverage is the key. So have they been offered COBRA? Have they been offered state continuation in some respect? Or are we just, or are they continuing to be provided coverage under the leave of absence provision in the summary plan description. So it's just important to look at that and make note of it. The other thing we talked about, the COVID-19 testing being free. Well, it's free to the patient, but in a self-funded plan, that doesn't always equate to being free. That if the employer is in a self-funded plan, those are claims that are going to be running through your self-funded plan, and so the COVID testing is not free to the employer. The employer is paying for that through the self-funded claims pool. Last but not least, I just say that if there's any communication from the stop-loss carrier about how they're allowing coverage, be sure to read all the way through their notification. And what we're finding is at the very end of those notices, the stop-loss carrier says that they'll do all these things, but they require a written plan amendment for employers to participate. Some are doing opt-out, others are asking for a written amendment. So just be sure to evaluate options and then follow through on it. We're getting ready to open up things to a Q&A session here. I wanted to throw up Mike's information again to make sure that everyone had time to jot his info down. And then real quickly, just kind of wanted to point out for employers that are maybe curious about specific carrier responses, on our website under our Insights tab, we've got a post here, the carrier responses to COVID-19. How does this impact group health coverage? This is where we are compiling sort of a laundry list of responses from the carriers that we've received, updated as of today. Here's a quick example here. Aetna AFA, if you're in an Aetna AFA plan, they are allowing employees who are in a reduced hour state or a laid off state to continue coverage on the Aetna plan through July 31st. But that's as long as you continue to pay your bill. So it's somebody's got to pay the premium. And if we look at that versus say a Humana sent out their notice and said essentially the same thing, both on the fully insured and the self-funded side through May 31st. Again, that's subject to making sure that payment is received for premium on the fully insured side, and on the self-funded side, just paying the admin fees and claims costs. So that resource is available. We're going to continue to update this on a daily basis as more carriers respond, and just to continue to have that as a resource for employers that are asking the questions. So I'm going to jump in. Did you happen to look at the questions here?
Jason, I looked at a few Q&A. Would you mind putting up that picture that I told you we might use?
Yeah, absolutely. There you go.
That's great. I'm assuming you all can you see the Q&As that other people have written?
I think they can see it here. I'm going to go ahead and let's see. That first question is, if you have an employee that's a driver and is currently in quarantine at home as his daughter was showing symptoms, is he to be paid 70% of his average wage as normally paid by commission? And if so, how long would that be relevant?
And I'll dovetail the next question. If an employee's sick, recovers, and then a family member gets sick, do we pay the 8 hours plus 2 weeks and then another 10 hours for something else? I think the picture here is to try and give you some guidance on what we have interpreted and are advising on this. If this is a matter of extended family medical leave, day 1 through 10 in the Act says it's unpaid. The sick pay says you could get emergency sick pay at 2/3 your rate for that 10 days. There are dollar maximums on this, not timeline maximums. But the outcome of this is we're going to recognize it's a choice for the employee to make how they want to get paid those first 10 days. Either use your PTO or other employer available, which is normally at 100% pay, or 2/3 pay for these first 10 days. And the driver, now let me make another thing clear. This only starts today, not yesterday, not last week. And there are a lot of people who have been paying their employees under various arrangements or goodwill nature. But for you to get credit on your employer FICA, the clock starts today, because this is the beginning of the second quarter. And when you do your quarterly filings for your taxes, that's when you're going to be able to offset your employer FICA with the wages you've paid. And I got a hunch, anybody who tries to make that offset in first quarter for monies they've paid because somebody's been quarantined or whatever, you're only going to get the credit. So the other part of this is after day 11, the driver who needs to take care of the daughter and or school's closed would be able to continue to receive 2/3 up to $10,000 maximum payment. It's a maximum payment, not really a number of weeks on this emergency family medical leave. We're used to 12 weeks under the traditional family medical. These sick and an emergency family medical is based upon $1 maximum. So the truck driver could really choose, does he want to get his PTO for the first 10 days and then kick in? Or does he want to get 2/3 rate? Those are the options that you could take care of. The other part that the CARES Act tried to clear up a little bit is basically no double dip. So on the second question, if somebody's burned their sick pay for themselves, can they burn it for somebody else? And the spirit of this is no double dip. And so that being the case, you could see where there's potential for people to try and continue to come back with another reason to get another 10 days and another 10 days and another 10 days. And our counsel is, the spirit of this is no double dip. The last thing I just want to offer is, okay, what if somebody's quarantined and they get their 10 days sick pay and they're still really sick? Day 11, 12, there's no provision for that in this particular Emergency Act. What will happen here is that the employer's standard benefits will kick in. What will also happen here is if somebody really is ill more than 10 days, someone's going to need to turn on traditional FMLA and get that started using the criteria for traditional FML, which will require medical certification, which may result in a disability application. And so the coordination of events between the first 10 days and what may happen after that needs to be watched in a timely manner. And so that's the other area where we have overlap of laws and conditions that are going to start to have to be taken into consideration. So I hope that chart offers a little bit of guidance to the first couple of questions.
That's great. And just to answer, I think everybody now can see the actual questions and answers. I think Rick turned on that feature on the background. So another question that came in was, if an employer typically contributes to the employee cost of coverage and the carrier has waived the actively at work requirement, can the employer elect to allow laid off and or furloughed employees to remain on the plan during their leave, but choose to stop contributing, meaning the employees would be responsible for 100% of their own cost while on leave, and expect employees to pay them by the time their invoice is due to the carrier? Employer has less than 50 employees, but more than 20, so they are COBRA eligible. Also of note is that this particular employer is a church on an ACA community rated plan. curious for other types of employers as well. That's a great question. That would really, you really have to look at the summary plan description because we're talking about laid off and or furloughed employees. So they're on a leave of absence. I'd say you'd have to look at the SPD to really address whether or not coverage can be continued. If it can be continued, most of the carriers at this point have come right out and said that as long as the premium is paid, then that coverage can be continued for some period of time.
I love that. This is just a basket of laws right here.
Right.
So
hey, Jason, do you want to let Damon speak a little bit to see if that answers where he's going with, or Mike, do you want to answer first?
Well, I'll offer a couple of observations just from my HR side. One, usually the employer has a contract with a provider that illustrates how much the employer contribution will be. And if you're going to elect to negate any employer contribution, then you could be in conflict with your contract. The second thing, because these are furloughed, which means these are active employees on your roster, and so there needs to be some continuity of how these are being treated. That's different than COBRA when you're formally terminated, and that's 102% payment. The second thing is, I think you might run into ERISA, because I think treating furloughed employees different in the way you've treated their health and welfare benefits, different than those remaining employed, might stumble upon some conflicts there when it comes to the pre-tax nature of the contributions that are being made. Because what you're saying is the employee able to make these payments 100%? Are they pre-tax payments? Is the employer contribution the same for others? I think you could stumble on some ERISA things. Here's the other fun part. You're a church, so ERISA doesn't always apply. And so you're running into a lot of other factors that the rest of the world might have to have a deeper consideration for than what you can get away with. So I love that, because as I read that, there's a basket of laws. And I think the thing that's most amazing with this entire instance is the number of laws that are influenced by everything that's happening today. There are laws. There are HIPAA laws. We can't go around talking about other people's health condition. There are OSHA laws. We have to have a safe work environment. Does one trump the other? There are ADA considerations. We go around taking everybody's temperature. That may help OSHA feel good about themselves, but what are we doing about other conflicts that may arise? There are EEO Title VII issues that are happening today because of this. There are so many different laws that are already in place. And under normal circumstances, we've thread the needle every day we go to work with all the ERISA laws, all these different laws. But you plop this thing on top of all of that, it really has people figuring out which end is up. But I think the key is to make sure there isn't overcompensation on one behavior that has a negative consequence on another. And that's where I think this is fascinating for all of us to just be sure that we've thought through actions so that there isn't an unintended consequence against another law somewhere else. Fascinating. That being said, I'd be interested if there's anything more Damon would like to share.
Let me grab Damon. Damon, are you there? Oh, I mean,
yes, I'm here. Can you hear me?
I can. Did that help answer your question?
That did, actually. The one question in particular is, does the employer have the choice to stop contributing without officially terminating the employee and making him fill out COBRA paperwork? And I do think that contract that the employer has with the employee would be the obstacle in that position. So that was the main impetus for the question. I have had carriers tell me that employers, even if they laid off their employees, can choose to just keep their employees on their plan, whether they're laid off or furloughed. of course, I'm recommending that my employers furlough their employees. I haven't had anyone elect to keep their employees active. Even though they've been laid off. But my main question was, can they just choose now all of a sudden to stop contributing to the employee's health plan due to the crisis and due to them being furloughed? Because that's what a lot of employers are wanting to do at this time in order to cut costs.
That's a great problem. It's sort of, you know, you're stepping with one foot in the I want to keep you sandbox, and the other foot I don't want to keep you sandbox. And again, I think that the consideration here is it's tough to do both, especially if your contract with your carrier has certain expectations you are going to make contributions, and you're either employed, active, because the implications also go into 401k. The implications all go whether or not, you know, they're going to be in your testing. So I think it's difficult to think we're going to solve one problem without creating another problem downstream, which is why I personally am trying to advocate there's a line, you're either in or you're out. And it will make things a lot cleaner because that's the way the rules are written today for all these other laws that are out there. It's a tough one. You know, AMC just furloughed their 600 employees here in Leawood, and they're continuing their benefits, yada, 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 because that's what you do on a leave of absence. That's why I combine those two words. And there's an end date when that furlough and failure to return from furlough will result then in a termination. End of plan, eligible for COBRA. So if we try to stay true to the way it's been designed, I think it's safer not to trip over things that may otherwise cause harm down the line.
Yeah.
It's tough. Yeah.
Yeah. All right. So we got a question. I think I got this one. So even if a self-funded plan furloughs its employees, they must continue to pay into the plan. And the answer to that is they still got to continue to pay premiums for the stop loss. You still have to pay administrative fees to the administrator, and you still have to fund the claims that are coming into the plan. That's really what I was addressing there. In a small group level funded plan, that's gonna really equate to you still got to pay the bill. But for larger groups, the real concern is in what the total risk is, making sure you understand that the stop loss policy itself, and continue to provide funding for the claims that are coming through to the plan. Got a question. What is the cost for a COVID-19 test? On average, we have seen that they run about $200, but that is not a uniform across the board. World of PPO contracts, what we're finding is that it depends on what the logo is on the front of your card. So it's not a uniform response for sure. Quest Diagnostics, I think we saw their charges are $200 for a standard COVID-19 test. Let's see, we got another question. Does 2/3 pay for employees include tips?
You know, you're catching me a little flat-footed. I want to say it does, but I'm gonna scroll here and while you answer the next question,
Got it.
Look at the act itself. Since part-time employees, you take the average of their earnings. I would expect that average of earnings is really more the dominant piece of this, but I'm gonna look at this real quick and see if there's anything that jumps off the page. Okay.
And then looks like I've got this one. Does your web link include information on level funded plans for United Healthcare? It does. It actually takes you, United Healthcare did a good job on their response. They actually take you, that takes you to a page on their site dedicated to answering questions about not only COVID-19 coverage, like testing coverage, but they also talk about employers, how employers are, answer some of the questions that employers have, the impact on layoffs specifically. So, John, let's see. Please repeat your comments regarding how long an insurance carrier will allow an employee to remain covered on the employer's medical insurance while on furlough. It really depends. Depends on the language of the summary plan description or the language of the document. So if it's a lot of carriers have. They've all responded differently. Some of them have language allowing for coverage to continue up to 12 weeks. Others have said they can continue for 30 days. On the website itself, on our webpage, I kind of pointed out two examples where Aetna is allowing employees in a reduced hour state or layoff state to continue through, I think it was July 31st, whereas Humana was allowing coverage to continue through May 31st. So it just kind of depends on the insurance carrier. Will we be able to get an electronic copy of the slides? We're actually going to post, I think we're going to try to post a
yeah,
link.
we're going to try to post a link to this, but if you would like an electronic copy, go ahead and email us, and I will post the email address for that, but you'll be email Stephanie and she'll get it to you.
Yeah. Okay. Is there FMLA for telling your employees to stay home and pay them to keep the virus from spreading? Mike, I don't know that really applies, does it?
You know, it's one, that would be a dicey thing to do. You might not have any employees. Two, or maybe that doesn't matter. One of the things that I think in the actual implementation of this is whether the quarantine is employer requested because of a specific basis for which you would be eligible versus an employee asking, hey, I just don't want to hang around these people because I'm afraid I'm going to get sick. And so this is the area of gray in whether or not the request is really going to fit the criteria or not. Think of it as a first degree of separation. Yeah, I was infected. I was in New York City. I just got off a plane, blah, blah, blah. That also falls into health department and governmental quarantine. So that's an easier one. But just because I'm a little anxious about it may make eligibility for this a little more challenging. And so I think that's where this is an exercise in gray. But I would prefer to lean on the side of, especially if you're an essential business, because I have seen, if you are an essential business and you just don't want to show up, I had a guy call me and say, hey, I got an employee who just wants to go to Colorado for 30 days and just be gone because he doesn't want to be anywhere near this stuff. Well, the guy had an essential business, and he did not have a business case for being gone. He did not have a clinical case, meaning he did not have a compromised immune system or other health-related reasons that would have been legitimate. So in that case, the guy basically abandoned his job and is not eligible, nor frankly is he required to retain employment. So it's not a black and white, but it's a preponderance of which way and why and who's deriving this decision. And I think that's where these are going to have to settle in over time with the consistent way that people are handling their business. Fascinating.
Yeah. Will a furlough impact an employee's FMLA or disability eligibility date, or is that insurance company or policy dependent? Mike?
All right, I missed that. Is that for me?
Yep, I'm sorry. Will a furlough impact an employee's FMLA or disability eligibility date? Or is that insurance company or policy dependent?
It will be the term actively employed. And if you, FMLA has 1,250 hours in 1 year. So does a leave of absence affect that? Yes. If you consider a furlough in the same bucket as a leave of absence, I would say yes. Disability, I'd say check your carrier and check your SPD, because I wouldn't want to speak for that as a general rule. I'd say for eligibility for 401k.
Yeah.
So again, there's a lot of downstream elements that I think need to be looked at. How is your plan written, your 401k plan written, and what constitutes eligible hours? And do leave of absences fall in that? How about PTO calculation? Do you calculate accruals for PTO based upon leave of absence? So I guess it's an answer that needs to be looked at in the way each one of these plans is written. And I think it would be safe to say there's a single answer that fits all those circumstances, because they're probably not all going to look at this time period the same.
Yep. Let's see. Interested in the comment regarding early prescription refills in that restrictions have been lifted. Can you expand on that? Is that up to respective PBMs? Has this been mandated? How and who is this being communicated to? I've got that one. So not all. It's definitely not uniform or consistent across the board. We have seen various responses from various carriers, but the common thread is that the PBMs have moved into play the kind of lifting that restriction temporarily, and that's being communicated back out through the various insurance carriers or administrators. Karen asks, when can we expect the forthcoming regulations for small business with less than 20 employees to be exempt from the paid sick leave and or expanded family medical leave? I think we're all waiting on those regulations, right, Mike?
You know, we are. I'm going to offer the following, just as counsel to think about. One, we have groups that are looking for exemption. I would just say there's two ways of looking at it. If you're looking for a financial exemption, I don't know that you'll get as warm fuzzy, because these are subsidized anyway. So the other way of looking at it is key employee. I've got 15 people in my pizza shop, 3 pizza cooks, and 12 drivers. If my 3 pizza cooks are all gone because their kids can't go to school, I can't make pizzas. The viability of my business is at stake. I would offer somebody who can't be there for areas of FML is the exemption you probably have a right to make, because it's legitimate on the viability of your business. Someone making this call because we can't afford it might have a harder time because the wages are subsidized anyway. And if you're not even in business because your doors are shut, that's a whole nother discussion anyway. So the forthcoming regulations, April is what I've read. I'm just trying to counsel people to say, look, if you're really in dire straits and you got 3 pizza makers and they all have kids and none of them can show up for work because they all got to watch their kids, then act now and ask for forgiveness later, because that's a viability of the business that you would have a pretty strong case of reasoning why you would be exempt from that.
All right, I got one more here. So if an employee with an underlying condition and doctor's recommendation wants to take the additional 10 days of sick leave, they would only be paid $2,000 for that period.
Yes, the 10 days are the 10 days. Now, here's the other part of that. If they have an underlying condition and they just can't be around it, now the employer's other forms of sick pay come into place. Now the employer's obligation under ADA kicks in. And I may have to make an accommodation to that person because their immunity systems are so compromised, they just can't be around it. So I may have a disability situation on my hands because this person has a bona fide pre-existing medical condition that creates the environment a little more complex. And so this is where you have an intersection of different laws and different ways that people might need to be dealt with when you have somebody who has an existing condition. It will go well beyond the 10 days as your remedy. So case by case, you want to just be sure we're weaving our way through all the different rules and making sure we're playing fair and doing everything we're supposed to do.
Just a quick note. Looks like someone put a note in here for you, Mike. The DOL just published regulations at 2:19 today. So,
oh dang it, I'm not on.
As fluid as this has been, we were probably jumping on this particular call. So, in the matter of time that it's taken us to have this meeting, the DOL published regulations. So that's great. Thank you very much.
In the speed of Twitter.
Yeah, right. Well, it doesn't look like we have any other questions open in the Q&A box or in the chat box.
Can I offer the tip thought?
Yeah, for sure.
I don't want to leave that hanging. Of course, the Act doesn't share that with us. So here's the perspective that I would share on how to answer this question. Are tipped wages included in the calculation of sick pay or 2/3 pay or whatever pay you want? I'd probably look at the following. One, what does your current sick pay policy say? Two, what is your short-term disability, if you have it, used to calculate? Three, earned wages are different than cash tips. So what was reported, so you have bona fide opportunity to document. And so I'd probably look at those three things, and then I'd probably look at my maximum, $200 a day maximum or $511, depending upon which type of leave it is. And I'd probably make an honest decision in fairness to the employee, so I had consistency on how I was going to treat sick pay. Do you calculate PTO using some kind of tipped? So trying to find a common denominator in the way you're treating wages for other categories would be the smartest way to be sure you're treating it properly here. And furthermore, since it's subsidized anyway, what the hell do you care? You might as well pay them as much as you can pay them. Because if you can document it through earned wages on a W-2, I would say I'd probably err on the side of helping the employee with as much as I could help them with.
We did have one more question come in. Do companies deemed essential need to be careful in, one, taking necessary steps to make accommodations for those high-risk employees, respiratory, diabetes, pregnancy, et cetera, over non-high risk, or two, selecting those high-risk employees for furlough or leave? Slippery slope?
Oh, yeah.
Right?
I think it's very slippery slope. I think that ensuring that you're adhering to, here's the confluence of all the laws, HIPAA, ADA, being fair to the employee, appropriate action based upon medical evidence. It really isn't any different than it always has been, to be honest with you. If you think of people with pregnancy, or you think of people with asthma and the work environment and the terms and conditions under which you might need to put them in another location or work from home to accommodate. It's just that we have this overarching virus scenario that's somewhat altering our logic, but trying to stay consistent and responsive on a case by case. That's the slippery slope. I would just say, just try and stay within the realm of reasonableness. And when you do that, everybody else will see what's going on and probably respect that. So, but it's a case by case, slippery.
Indeed. All right. If I don't see any other questions in the Q&A, if you do have a question, if you don't mind raising your hand, we might just take it live here. All right. I don't have any hands going up. Mike, I know I greatly appreciate your time and your information. I hope that everyone got some sense of direction and guidance out of today's webinar. We'll see you. We'll see how the DOL guidance and the everything else is kind of snowballing.
We're navigating in a fog. We're just, all we have is our instrument panels. We can't see the landing strip. But I would say that I appreciate you guys teeing this up, because the intersection of the HR and the benefit piece, I feel strongly that we want to be sure that we do it right, that people understand the risk, that the carriers are being looked at and we know what grace they're giving, and that nobody ends up in a bad place because somebody didn't tell them Humana dropped you last month because you haven't been working. And I appreciate you guys being available. Your resource is tremendous on your library of the carriers' positions on all these different areas. So I hope everybody listening can pay attention and go to that site and look and see what your carriers, and don't just take the carrier, be sure, like that Aetna, it was people with certain plans. So don't read that as an absolute, and make sure that you've done due diligence on understanding your particulars. And then you get into disabilities and you get into all these other carriers. And so I would just say, be diligent on making sure that you've done a little homework.
And with that, we'll close out. Thank you, everyone. We'll see you next time.
Thanks.
Thanks, Mike.